In 2013, during the winter circumcision season in Pondoland in the rural Eastern Cape, there were an enormous amount of deaths as a result of botched circumcisions. The media covered this really widely, and I was thinking about how to cover the story a bit differently. A doctor then got in touch with Bhekisisa, telling us about something even more traumatizing. He had several men admitted to the hospital as a result of botched circumcisions. But their condition was that they had either no penis or only a little bit left of their penises. And they essentially lived lives of fleeing from one village to the other because they were so scared of being discovered. I then flew to Flagstaff. Holy Cross Hospital was where the doctor worked, and interviewed these men with the help of translators. And they were very generous to speak to me as a woman about such private problems that they experienced. Their interviews were incredibly powerful, and that was perfect material for a long-form narrative story. Once that story was published in the Mail and Guardian's print edition, the doctor contacted me and informed me that the Eastern Cape Health Department read it and made hundreds of copies of the story to distribute among staff and also chiefs in the area. As a result of that, the chiefs and the health department officials came together to talk about problems between traditional circumcisers and medical circumcisers, so doctors who circumcised in the area. There were problems for them to work together, and those problems centered around cultural differences. Medical doctors came into the area because of evidence that shows that when the foreskin of a penis is removed, the ability of someone to contract HIV is significantly reduced. But traditional circumcisers in the area felt that they've had a century-old tradition that's now being interfered with by Western practitioners. But after the meeting that the health department officials and traditional chiefs had, also along with a medical organization in the area, many of these problems were resolved, and chiefs helped traditional circumcisers to start working with the medical officials to make circumcision safer. Shortly after the story was published, the health minister at the time, Aaron Motsoaledi, also contacted me to ask for the contact details of the doctor. He then flew the doctor to Tshwane and asked him to give formal input into a safer policy and an updated policy for circumcision. About 2 months after the story was published, the drama department of Wits University contacted me and asked if they could use the story to write a play with. They used verbatim quotes of the amputees, and it was all built around the stories of these amputees. The play was then produced and performed by the National School of the Arts at their national festival that year, and also around the country as an educational tool to make people aware of safe circumcision. The doctor then brought some of these amputees to Johannesburg to see the play, and it was an incredibly validating experience for them to see their lives being portrayed, because they live in a community where they can't tell people what has happened to them because they will be discriminated against and they will be stigmatized. But here they were sitting in an audience, seeing their lives playing out on a stage and feeling validated.